This case is an example of cervical cancer screening in an Aboriginal woman. So let's talk about the cervical cancer screening and who are the Aboriginal women. Cervical cancer screening is trying to screen or look for specific types of high-risk human papillomavirus. Try to detect these types in your cervix, okay? The high-risk human papillomavirus types are human papillomavirus 16 and 18. These are the most common types that are known to cause the cervical cancer. However, there are other types. These other types is known as non-16-18, okay? So high-risk HPV virus type 31, 35, 39, 33. The most common type to be of very high risk to cause cervical cancer is 16 and 18. About the Aboriginal woman in Australia. These people are the Aboriginal women of Australia. They are the original people of the land, okay? So let's return to our case. A 34-year-old Aboriginal woman attends for cervical cancer screening follow-up. Why follow-up? Because 1 year ago, her cervical cancer screening test detected the high-risk type of HPV, of human papillomavirus. But it's not the 16 or 18 types, okay? It's not the 16 or 18 types. It's probably other types than the 16 and 18 types, but it's high-risk types of human papillomavirus with negative cytology. So the cervical cancer screening test could detect the virus type, but there is no evidence of cancer, of cervical cancer. Okay, there is evidence of viral. So this patient is positive for human papillomavirus, high risk type. However, it's negative for cervical cancer. The cytology is negative. She is asymptomatic, and the patient is asymptomatic. This was 1 year ago, okay? Now, a repeat test performed now again detects the same. The test came positive for human papillomavirus, high risk types. However, it's not a 16 or 18 type. And there is no evidence of cancer, negative cytology, no cytological abnormalities. So what is the most appropriate next step in this case? Refer immediately for colposcopy, return to 5-yearly routine screening, perform human papillomavirus genotype, repeat human papillomavirus in 12 months, perform excisional biopsy. The correct answer is to repeat the human papillomavirus testing in 12 months. as you know, normally the cervical cancer screening is offered every 5 years. 5 years, starting from the age of 25. So, starting from the age of mid 20s, okay, the cervical cancer screening will start and repeated every 5 years. However, in this case, with positive high risk human papillomavirus, okay, positive here, cervical screening test was positive for human papillomavirus, okay, so the screening needs to be repeated not every 5 years, but every year. Okay, the cervical screening test will be repeated every year in this case instead of every 5 years. So, repeat human papillomavirus testing in 12 months. According to the National Cervical Screening Program, women with persistent human papillomavirus, non 16 or 18 type, persistent human papillomavirus and negative cytology, should undergo 12 months surveillance. Not immediate colposcopy. So the colposcopy is not recommended here. It's invasive procedure. Okay. However, the immediate colposcopy is reserved for abnormal cytology or for patients with positive HPV virus types 16 and 18. So, if the patient is positive for 16 and 18, human papillomavirus testing is not repeated every 12 months, and immediate colposcopy should be performed. Okay? Because human papillomavirus 18 and 16 and 18 is associated with very, very high risk of cervical cancer. So this patient will need immediate colposcopy. And if the screening test came with abnormal cytology, this requires immediate colposcopy. Okay. Aboriginal women follows the same clinical algorithm, which emphasizes on culturally safe follow-up. 5-yearly screening is unsafe with persistent human papillomavirus infection. So if the tests came positive for or persistent for HPV virus, okay, which type HPV virus other than 16 and 18, you should replace the 5-yearly screening into yearly screening, okay? HPV genotyping has already been performed. During the screening test will perform human papillomavirus genotyping to detect the type of the virus, either the high risk 16 and 18 types or non 16 and 18 type. Excisional biopsy is inappropriate without high grade abnormalities. So the excisional biopsy should be performed with high grade positive cytology, high grade abnormalities or abnormal cytology. So let's talk about the cervical cancer. So this is the first case of cervical cancer. On CT images, the presence of hydronephrosis indicates what clinical T stage? T3A, usually due to involvement of the ureter or urethrovaginal junction. So as you can see here, this is the cervical carcinoma. Okay, heterogeneously enhancing cervical mass on T2-weighted image. This is the cervical mass. So as you can see here, this is the sagittal T2-weighted image of the uterus. Normally, the endometrium, okay, and the endocervical canal of bright signal on T2-weighted image. The junctional zone is of dark signal, and the myometrium is of intermediate signal. This is the myometrium is of intermediate signal. Here, the endometrium, the endocervical canal is dilated. Okay, sorry, the endometrial canal is dilated by a cervical mass. Okay, the cervical mass here is obstructing the endocervical canal with dilatation of the endometrial canal. So the cervix is enlarged by a mass obstructing the endocervical canal and causes dilatation of the endometrial canal. On CT images, so in CT images, there is a heterogeneously enhancing cervical mass obstructing the endocervical canal with the dilatation of the endometrial cavity. On CT images, the presence of hydronephrosis. If there is hydronephrosis of both kidneys, this indicates involvement of the ureters by the cervical mass. Okay, this indicates the involvement of the ureters by the cervical mass, and the grade of the cervical cancer here is T3A. So ureteric involvement will raise the grade to T3A. T4 is for vaginal involvement, if there is vaginal involvement. Okay. If there is no ureteric involvement, 2A, it will be stage 2. So stage 2, if there is no involvement of the ureters. T3, if there is involvement of the ureters. T4, if there is involvement of the vagina. On MRI, extension of disease beyond the black cervical stroma indicates extension of disease into what structure? The parametria, the veins, arteries, and nerves supplying and draining the cervix. So an MRI, extension of the disease beyond the black cervical stroma. This is the black cervical stroma. If the disease was extending beyond the black cervical stroma, indicates the extension of the disease into the parametria. into the parametrium. Okay, and the parametrium contains the vessels, nerves, arteries, and veins supplying the cervix. Among cervical, ovarian, endometrial, and endometrial cancer, which has the lowest incidence? The United States. Cervical carcinoma has low incidence. Why is MRI the best test for local extension of disease? The high signal contrast allows identification of the disease beyond the confines of the cervical stroma. This determines both therapy and prognosis. So MRI is considered the best for local staging of cervical carcinoma because it can detect local extension of cervical cancer beyond the black cervical stroma, very dark cervical stroma, into the parametrium. This is another case of cervical cancer. This is a T2 sagittal image. The T2 fat site axial image. Can you see the cervical cancer here? All of this is the cervical cancer. And here, this is the T1 contrast enhanced and T1 axial contrast enhanced. So sagittal T2 weighted image, fat suppressed, axial fat suppressed T2, and axial contrast enhanced T1. MR images of the pelvis. A large exophytic T2 hyper-intense heterogeneously enhancing mass. A large exophytic T2 hyper-intense. So the cervical mass is of hyper-intensity on T2 weighted image. A large exophytic hyper-intense T2 heterogeneously enhancing mass. This is a post-contrast image. This is the mass, heterogeneously enhancing mass of high signal on T2 weighted image, the mass of high signal compared to the myometrium here. So it is of high signal compared to the myometrium. Heterogeneously enhancing mass arises from the posterior lip of the cervix. This mass arises from the posterior lip of the cervix. The mass extends beyond the cervix into the parametrium. This mass extends beyond the cervix into the parametrium. So the mass extends beyond the black cervical stroma. The black cervical stroma extends beyond it into the parametrium. As I mentioned, okay, rectal involvement is present with loss of intervening fat plane. The mass is involving the rectum. This is the rectum, and the mass is involving the rectum with loss of intervening fat plane. There is no fat plane between the mass and the rectum. MR imaging is used for staging, local staging of cervical cancer, and can measure accurately the tumor size and the invasion. Pelvic lymphadenopathy can detect the pelvic lymphadenopathy. Stage 1 disease is confined to the cervix. So, if the cervical mass is confined to the cervix, does not extend beyond the cervical stroma, it is stage 1. Stage 1. Stage 2 disease has upper vaginal involvement. Stage 2 disease extends to the upper vagina. Extends from the cervix to the upper vagina. Stage 2A. 2A and 2B. Stage 2B extends beyond the cervical stroma to the parametrium. Parametrial invasion. 2A has no parametrial invasion. Then stage 2A has upper vaginal invasion. 2A upper vaginal invasion. 2B parametrial invasion. Extends beyond the cervical stroma to the parametrium. This is stage 2B. Stage 3A, lower vaginal involvement. 3A, lower vaginal involvement. 3B, extend to the pelvic side wall or the ureters. Extends to the pelvic side wall and to the ureters, and it will be associated with hydronephrosis. Extension to the adjacent organs, bladder or rectum, is stage 4A. So then stage 4A extends to the adjacent bladder or rectum. 4B, distant metastasis. Distant metastasis. In this patient, the T2 hyperintense mass obliterates the T2 hypointense cervical stroma. In this patient, the T2 hyperintense mass. T2 hyperintense mass obliterates the T2 hypointense cervical stroma. I can see any cervical stroma here. And extends to the parametrium. Extends to the parametrium. Okay. So this one is stage 2A. 2B. 2B extends to the parametrium. And also extends to invades the adjacent rectum. So this stage is 4. Stage 4A, because it extends to the adjacent rectum. So rectal involvement makes the stage 4A cervical cancer. Risk factors for cervical cancer include high-risk human papillomavirus. So the screening test depends on this virus. Risk factors for cervical cancer includes human papillomavirus infection. Human papillomavirus infection. And the human papillomavirus infection will come from the multiple sexual partners. Sexually transmitted disease from multiple sexual partners. Squamous cell carcinoma is the most common type of cervical carcinoma. Squamous cell carcinoma. Cervical cancer presents as vaginal bleeding. Vaginal bleeding. Most frequently occurs in women after 45 years. After 45 years. MR imaging accurately differentiate early cervical cancer. Stage, can see the MR images can detect the stage 1 and 2A, the early stages. Stage 1 confined to the cervix, stage 2A, stage 2 upper vaginal invasion. Yes, confined to the cervix, upper vaginal, and the parametrial invasion. So MRI can detect the early disease, can detect the early cervical cancer, which is confined to the cervix or to the upper vaginal, confined to the cervix and the upper vaginal. Which is treated surgically. The early disease which is confined to the cervix and the upper vagina, it will be surgically removed, treated surgically. More advanced disease, starting from 2B, which extends to the parametrium. 2B extends to the parametrium, and 3 extends to the lower vagina, and 4 extends to the adjacent urinary bladder or adjacent rectum. So more advanced disease requires radiotherapy and chemotherapy. First, the patient will receive radiotherapy and chemotherapy, then surgery. Cervical cancer is T2 hyperintense, which helps differentiate it from the T2 hypointense cervical stroma. So cervical cancer can be easily detected on T2 weighted image because it is T2 hyperintense, which will be easily differentiated from the T2 hypointense cervical stroma. The hyperintensity signal of the cervical cancer on T2 makes it easily differentiated from the hypointense signal of the cervical stroma. PET-CT scan help in staging and detecting the residual recurrent disease. So PET-CT scan can be performed after treatment of cervical cancer to help detect residual or recurrent disease. Ultrasound is not useful for detecting or staging cervical cancer. Okay, ultrasound is not useful. Management of cervical cancer, surgical for early disease. Early disease, stage 1 confined to cervix, stage 2 confined to the upper vagina, 2A confined to the upper vagina is treated surgically. For advanced disease, starting from 2B parametrial invasion, 3A upper vaginal invasion, 3B ureteric invasion, 3B ureteric and pelvic invasion, 4 stage 4 to the adjacent urinary bladder or colon. All of these are advanced disease. There is extension and invasion. Okay, this requires radio and chemotherapy.